All right. Good evening, ladies. Welcome to Wellness Wednesday once again. All right. I hope everybody's doing well. We're going to, again, wait while hopefully everybody who is joining us has jumped on by now. Hopefully you've been having a good week. And I've had several patients this last week talk about allergies. And that's going to be the topic that I'm going to be discussing. First of all, I'm going to get through my disclaimer though while I'm live on these sessions. So any information that is shared during this Wellness Wednesday should be considered health information and not specific health advice. Please do not stop taking or start taking or change the way you are taking any of your medications. If you do feel like you need to make some changes there, please consult with your prescribing practitioner so that they can help you make those appropriate changes. And by participating in this Wellness Wednesday tonight, this does not establish a doctor-patient relationship. All right, very good. Now, I want to make a clear distinction between allergies. What I'm talking about is not the allergy that you might have to a medication or to a food that causes anaphylaxis, meaning, your airway swells up and you can't breathe, or, it can be actually very dangerous, it could be fatal. So I'm not talking about that kind of allergies. I'm talking about, it's on the spectrum, okay, of that. That would be like the most severe, drastic outcome, right? I'm talking about the symptoms that you have as a result of being allergic to something, whether it's maybe a food sensitivity, maybe it's something outdoors like pollen or grass or tree parts, flowers. You can be allergic to mold. You can be allergic to pets. You can, these types of allergies that cause symptoms that generally affect your upper respiratory system. Maybe you get skin problems, skin irritations, skin symptoms, rashes and itching and so forth. Hives could be, along those lines. But we're going to focus on, I'm going to focus more tonight on kind of those upper respiratory symptoms that you can have, a lot of you have, where you're constantly clearing your throat, or you're waking up with, you describe it as drainage that you've got to clear out every morning. And your doctor just calls it allergies. Maybe it's a chronic cough. Maybe it's, sneezing and runny nose and itchy eyes and things like that at certain times of the year. So seasonally, those types of symptoms. Maybe you've been told that your chronic sinus problems are allergies. So we're going to go through some common causes of these types of symptoms, these upper respiratory type symptoms. And I'll just go through those, starting with so the causes. I want to talk about the causes. So I'm going to start with leaky gut. And I'm starting there because the gut is where your immune system actually starts. When you have leaky gut, and I've done a whole Wellness Wednesday on leaky gut. So I don't want to get into all those details again, but suffice it to say that because of leaky gut, undigested particles from what you eat can cause an immune reaction just under the cellular, that single cellular layer, that lining of your intestinal tract. And when that happens, antibodies can be produced, and right there in the gut, those are produced in what's called the gastrointestinal associated lymphatic tissue, GALT. And so that is responsible for 80%, for making 80% of the antibodies that you have in your body from your gut, from your intestines. And so this leaky gut thing is really important. So, well, how does this cause allergies? Well, what happens is through the enteric nervous system, enteric meaning intestinal, there's a nerve that comes from your brain, and it feeds every organ, every digestive organ, your heart, your lungs, your bronchioles. It feeds all of those areas, those bronchioles meaning your air tubes in your lungs, those major airways, windpipe, and whatever you want to call it. And so when you have something that's irritating that part of your nervous system in your gut, that travels up to your digestion. So you can have problems with reflux that will cause, I don't know where that came from. It'll cause problems with reflux, which will then cause irritation in your throat, especially at night when you're laying down, and what your doctor may have called allergies. When you wake up in the morning, you have to clear this phlegm and junk out of your throat. That is caused by irritation of it's not true stomach acid. It's acid from undigested food, actually, that pushes its way up or gets forced back up, maybe while you're laying flat, up and irritates your throat and causes your throat those cells, that lining of your oropharynx, to produce mucus. And that just kind of settles there. So then you have that irritation can go up into your sinuses, because you also have that nerve that feeds or inputs into those tissues as well, those mucosal tissues. And so they start to produce mucus. All right. So and histamine. So there's some histamine producing cells all through the tract. And so histamine can cause the sneezing, the allergy symptoms, the swelling, even up around your eyes and just all of that area. Okay. Your nose, your eyes, and so you get these allergy symptoms because of irritation in your gut. Now, I'm not saying that your allergies to outside are not caused by those things. You're not eating those things. But you are breathing them in. Potentially, you could swallow them. You breathe them in, swallow. They react here first, and it just compounds kind of the already decreased threshold for producing this mucus because of food that you eat, something that things that you drink, the sugars, the inflammatory foods that I've gone over so many times. Those same foods will then irritate that intestinal nervous system, part of the nervous system, vagus nerve, and then that travels up that nerve, and those signals travel up, retrograde, and cause those, those tissues to produce more mucus, and those cells, those mast cells, to produce more allergy, more histamines, producing the allergy symptoms. So, yeah, it's fascinating. This is what leads to these allergies. I can tell you for a fact that this is the case because this is how I got my own allergies better. Okay. Now, I was treated as a youth for allergies with classical homeopathy. But part of that was, whether you believe or not in homeopathy, that's fine. But part of that treatment was definitely removing those foods from my diet. So I had to, as a 10-year-old, I had to remove wheat, corn, milk, sugar, and then I had to be really cognizant about molds. And I mean, through my parents. I mean, they were the ones that were helping me with this, and my grandparents too, because they ultimately ended up paying for my treatment. But I had to avoid those foods. I couldn't have them. I remember bringing my lunch to school, where I was taking things like rice cakes and with something on them, whether it was peanut butter. I guess I didn't have an allergy to peanuts. I took vegetables, and I was kind of made out to be kind of the laughing stock. Some kids were pretty mean about what I had to take to school for lunch. I couldn't drink milk. I couldn't, I had to take like apple juice, and just things like that. There's things that weren't your typical foods that kids take for lunch. Definitely nothing with sugar or preservatives, no Doritos or Cheetos or stuff like that. So from a very young age, I had to I learned honestly that it was okay to be different, because I ultimately ended up feeling better. Anyway, that was kind of a sidebar, but back to these allergies. So if we also stop to think of some other things that might cause these types of symptoms that maybe have been diagnosed as allergies, but they're really not, let's talk about MARCoNS. All right, so MARCoNS is multiple antibiotic resistant coagulase negative staph. It is a bacteria that colonizes in your deep nasal cavity that is resistant to, like the name says, multiple antibiotics. And these bacteria are they're a strain of staph, which is a normal kind of bacteria for our, in our flora, on our skin, and in inside too. But it morphs, it pleomorphs, it changes depending on, well, how many antibiotics you've received, or maybe you've spent time in a hospital where this resides, because of all the measures that are taken to sterilize, the environment there. They actually promote, and you've seen this in the media sometimes, these stories about superbugs. All right. MRSA, you may have heard of MRSA, which is a type of antibiotic resistant staph bacteria as well. This is just like 10 times worse, because it's multiple antibiotic resistant coagulase negative staph. And what this bacteria does is it produces a neurotoxin. And so this can cause chronic sinus issues. So when your chronic sinus issues have been diagnosed as allergies, and they're not doing the right tests doctors aren't doing the right tests to identify what kind of bacteria this is, or what kind of problem this is. They might even not even suspected it's bacteria because, well, they give you an antibiotic and it doesn't work, and so they're like, well, it's got to be something else. Guys, there can be another type of bacteria, a multiple antibiotic resistant type, and this is tested for. Functional medicine recognizes these tests, um, and when you have this bacteria, unfortunately, this toxin causes a decrease in something called MSH, melanocyte stimulating hormone. Melanocyte stimulating hormone is and is found throughout the body. It's a very important immune system regulator. So you have this this immune system regulator, MSH, that will, if it's low, if it goes low, this makes you multi-susceptible. Now, in another wellness Wednesday, I discussed biotoxicity. So if you are multi-susceptible, this means that you become susceptible to mold, Lyme potentially, venoms, bacterial toxins. So there are several of those that I haven't talked about yet. And your immune system will not be able to clear these toxins out of your body. They will cause inflammation. These toxins, this particular toxin that the Marcons bacteria produces is known to cause vascular inflammation, the same inflammation that causes heart attacks and strokes, that causes plaque to build up in the arteries. All right. This is often one of the first, root causes for heart disease. And doctors aren't looking for it. They don't even, I don't know. I didn't know about it. I wasn't taught about this in medical school. So there we have it. Another reason for chronic sinus issues and that post-nasal drip that you get that produces mucus and it collects and during the night, right? So then in the morning you have to cough up all this stuff and there it is. Another common reason for chronic, sinus issues can be yeast and molds. Now, the same test that tests for Marcons, it's a nasal swab test, is also able to test for mold and yeast growth. So I had a patient who had chronic issues. She continually gained weight, had all sorts of energy problems, sleep problems, because, this stuff kept her awake. She would wake up for this stuff. And come to find out she had chronic sinus issues. Well, we did this test, found not only Marcons, but she was growing a strange kind of yeast. And I don't remember what it was called now. I really haven't seen it since. But on the report for the test, it actually said this is from bird droppings. Bird droppings. And I asked her, like, Tammy, what do you think about this? Like, does this make any sense to you? And she said, Dr. Redd, I used to work in this, I can't remember now what she did. She worked some kind of in some kind of a store or Anyway, I honestly can't remember what she was working in now, but she said that building always had this terrible smell and in the air, kind of a musty, dirty smell. And come to find out, they a bunch of pigeons were roosting on the roof on top of the swamp cooler. And that was coming in, being blown into the building. Okay. So literally the bird droppings were being blown, that particles were being blown throughout her work environment, and that had colonized in her nose, in her deep nasal passages, where she had inhaled this for years. And like we had to treat that was the cause of her chronic inflammation. Like, it was a huge cause of her inflammation. We looked these toxins up or these yeasts up, and sure enough, like many yeasts and molds, it produced toxins. So that was the root cause of her chronic, and she did well. She made a lot of improvements after that, and lost some weight and got some energy back, and made some real improvements until she had to, I believe she had to move away. And at that point, we weren't able to continue our visits, for I want to say for financial reasons. She had a very, it's not common to have something like that. It's fairly rare, but if we get the right tests, we're going to be able to find those obscure root causes, potentially, hopefully, and be able to treat that to help you resolve your symptoms. That was huge. That was a really huge for her. So mold toxicity, yeast can colonize in your deep nasal passages and cause these kinds of symptoms as well. So those were the main causes. I want to tell you about Lynn. Lynn was able to really improve with his leaky gut. Okay. And he informed me that his typical seasonal allergies were basically non-existent, as he had gone through his customized care program, and we had done the right testing, found out that he had indeed had leaky gut, and as we calmed those things down, as we certainly took out the foods that he was sensitive to, the 5 inflammatory foods, being the only changes, plus the supplements that he had been taking. Couple that also with mold detox, because he was also found to have mold toxins in him. His allergy symptoms improved. Also able to lose some weight, get some energy back, improve his sleep, and so there's a good example of finding the root causes and figuring this out for this individual patient. Okay, so that's what I wanted to cover, and I'm confident that as we really take a deeper look at things, as we try to find the root causes rather than just cover things up with bandages. Certainly there are a lot of antihistamines and eye drops and all kinds of things that you can do to bandage these symptoms. But in my opinion, nothing goes farther to help you regain your health than finding the root causes. And so as we think about allergies, these are symptoms of something deeper going on, telling us that things are imbalanced, things are not right. And so chronic allergies, whether it was, molds or yeast, whether it was Marcons, or, just leaky gut all by itself, caused by, these inflammatory foods and preservatives that we consume in our standard American diet. If we can get away from that, I think we will be able to get our health back. So, as always, please understand that there's still hope. There are answers, and you still have the power to heal. Good night, ladies, and I will see you next time.